So we will start with some background perspective. Road traffic injuries are the leading cause of death for children aged 5 to 14 years. It is also the leading cause of death among young adults aged 15 to 29 years, the 8th leading cause of death for all ages. It is estimated that there are 1.3 million traffic accidents every year, and every 24 seconds, someone dies on the road. Head injuries are the leading cause of death. The data you see on this slide is from the World Bank report in 2010, where they have ranked road injury as the 8th out of the top 10 leading causes of death, premature mortality, and disability. They have attributed 1.5 million deaths, representing 2.9% of all deaths, to air pollution and injuries from road vehicles. And these deaths include the top 3 causes of death globally, which are ischemic heart disease, stroke, and chronic obstructive pulmonary disease, as you can see there. So we see that motorized road transport is a major public health issue. This slide is a slide from the World Health Organization, and we see that in 2019, ischemic heart disease, stroke, and chronic obstructive pulmonary disease are the leading causes of death again. But we see also that road injury is not in the top 10 in this table, in this graph. But when we look to the right, we see that in low-income countries, like our country is a low-income country, road injury ranks as 7th. Of course, we live in CARICOM, in the Caribbean that is, and we will now want to know what the status of affairs is in CARICOM. And here we see on this slide that St. Lucia, Guyana in 2016 had the highest mortality due to road traffic injury. Now, this is not a surprise to me because I lived in St. Lucia for 13 years, and often driving on the roads, the terrain is very, very mountainous, and the mountains are very steep. And often driving on the roads, I would be so very careful. And sometimes when I looked over on the mountainside, I would reflect on the fact that if anyone goes down, it is very likely they will not survive. However, I am not sure what's the reason for the high rate in Guyana. In a nutshell, St. Lucia and Guyana accounted for approximately 40% of mortality due to road traffic injury in CARICOM in 2016. And we can also see that the global average is 18.1 per 100,000 population. And the available evidence shows that the risk of road traffic deaths are more than 3 times higher in low-income countries like ours than in high-income countries. Here in this slide, we see that low-income countries have 1% of the vehicles, but 13% of the road traffic deaths. In contrast to high-income countries that have 40% of vehicles, but only 7% of deaths. When we consider the World Health Organization administrative regions, and they have several regions, they have the Western Pacific, Southeast Asia, Europe, Eastern Mediterranean, the Americas, in which the CARICOM countries fall, and Africa. When we consider the World Health Organization regions, we see that between 2013 and 2016, there has just been a very small decrease of 0.1 in death rate globally. That is for road traffic deaths. Now, Africa has the highest death rate, followed by Southeast Asia, and then the Eastern European. And the lowest road traffic death rate is in Europe, which is considerably lower than the other WHO regions. And of the deaths that occur globally, 3% are cyclists, 23% are pedestrians, 28% are motorcyclists, 29% are car occupants, and 17% belong to other categories. 54% of all deaths are pedestrians, cyclists, and motorcyclists. Now, road traffic accidents, as the speaker before me said, can result in disabilities, the most common of which is mobility disability and cognition disabilities. But it can also result secondarily in depression, self-harm, suicide, alcohol and substance misuse, other forms of mental illnesses, secondary to head injuries such as epilepsy, psychosis, and dementia. And there are others, and we will revisit mental health complaints a little later in the presentation. But if you are unfortunate enough to end up with a disability or a mental health disorder after your road traffic accident, there are serious implications for the quality of your life after, in terms of huge stresses that you have to navigate, stigma and discrimination, and it can even affect your family members. As we saw earlier, 54% of persons affected are pedestrians, cyclists, and motorcyclists. And these people are already in the poor income strata of society and less likely to have financial protection in the form of insurance or money in the bank or otherwise. Subsequent, sometimes catastrophic healthcare costs from out of pocket can push many affected persons and their households further into destitution and cause direct or indirect issues with mental health conditions. Some affected persons may seek traditional healers and postpone medical care until their condition has deteriorated to a severe state, further worsening their risk for mental illness. And some persons may have severe chronic pain, which may put them at risk for self-harm, suicide. And chronic pain is a known significant risk factor for self-harm, suicide. So we just mentioned some of the issues that may ensue with a person in road traffic accidents. And those who develop disability and mental illness afterwards have additional challenges. And some of the additional challenges are violations of dignity and respect, as well as other human rights violations that degrade and diminish the affected person or the affected population. Use of words like cripple, moron, idiot, madman, higher rates of poverty, malnutrition, poor living conditions, decreased access to health and poor health status compared to other persons without disability or mental illness, decreased access to education and poor educational attainment compared to other persons, decreased employment opportunities, increased out-of-pocket spending on healthcare with threat of or actual destitution, lack of participation in decisions that directly affect their lives, higher risk and exposure to violence and abuse, higher risk of accidents and injuries, higher risk of anxiety and depression, lower productivity, reduced independence, inadequate legislation, policies, and strategies to protect persons with disabilities and or mental illness. Inadequate government funding on disabilities and mental illness, poor provision and or delivery of services for persons with disability or mental illness, lack of awareness and understanding about the disabilities and mental illness by the public, and increased risk of entry into nursing homes. And I am sure that there are more. So the life of a person with a disability or mental illness is extremely challenging. Now there can be many presentations for a person in terms of mental health for a person that was affected by a road traffic accident. And these include symptoms of depression, not amounting to depression, acute stress, post-traumatic stress disorder, bereavement, also known as grief, medically unexplained somatic symptoms, depression, self-harm, suicide, alcohol and substance misuse, other forms of mental illnesses that are secondary to the head injury, for example, epilepsy and dementia. Now, stress is a common response to any stressor. Everyone can feel stressed, and if it is not managed well, it can become overwhelming and debilitating. And it presents as sleep problems, behavioral changes, such as crying spells and social isolation, physical changes, such as aches, pains, numbness, extreme emotions, such as extreme sadness, anxiety, anger, despair, or persons can even be in a daze. Cognitive changes, such as racing thoughts, inability to concentrate or make decisions. And of course, serious accidents is an extreme stressor, and other severe stressors can be physical and sexual violence, humanitarian disasters such as war, epidemics, earthquakes, etc. The volcano eruption in St. Vincent recently will qualify as a humanitarian disaster. There's forced displacement, for example, refugees, loss of loved ones, and major losses, which can include loss of identity of your income, of your job, of your role, your social role, loss of country, in the case of refugees, loss of family members, etc. After exposure to extreme stressors, such as road accidents, most people will experience distress. That is normal and to be expected. And most persons will eventually develop equilibrium again and not need clinical management. But there are few that will go on to develop a mental health disorder. So one of the disorders that is associated with road traffic accidents is post-traumatic stress disorder. And after 1 month, persons can develop the following symptoms. They can start re-experiencing the symptoms as if it has just occurred or if they're actually going through it again. They can have avoidance symptoms. They can have symptoms that relate to a sense of heightened current threat. They can have difficulties carrying out usual work, so usual school activities, domestic activities, or social activities. And if these symptoms occur after 1 month of exposure to a severe stressor, we call it post-traumatic stress disorder. There is also bereavement, also known as grief. And grief is a normal response to loss. Persons can grieve for anything. It depends on the value that they place on it. It does not necessarily have to be death. So people's responses to loss can be overwhelming and wide-ranging, including low mood, despair, anxiety, fear, irritability, anger, loneliness, yearning, shock, hopelessness, low self-esteem, preoccupation with the person that died, negative thinking, self-blame, social withdrawal, loss of interest, loss of appetite, problem sleeping, aches and pains. As I said earlier, it does not necessarily have to be associated with a death. So it can be preoccupation with whatever it is that they felt that they have lost. So persons after an accident can also have medically unexplained somatic symptoms. And in that, people can experience multiple persistent physical complaints, mainly pains that are not associated with another loss. And a person can grieve for anything if they view it as a loss. So it does not necessarily have to be a death. In the case of an accident, a person can grieve for loss of health or independence. And the grief response is normal, as I said, and people's responses to loss can be overwhelming and wide-ranging, including low mood, despair, anxiety, fear, irritability, anger, loneliness, yearning, shock, hopelessness, low self-esteem, preoccupation with the person that died or whatever they have lost, negative thinking, self-blame, social withdrawal, loss of interest, loss of appetite, problem sleeping, aches and pains. And persons can also present with medically unexplained somatic symptoms. People can experience multiple persistent physical complaints, mainly pains that are not associated with another physical health problem. These complaints can be associated with excessive negative thinking, worries and anxieties, tiredness, low mood, hopelessness, loss of interest, weight loss, changes in appetite. Persons involved in a road traffic accident can also go on to develop depression. And depression is actually a very common mental health complaint to the extent that it is a public health priority. And there are 322 million people worldwide who suffer from depression. And so that will include all those persons who develop depression after their road traffic accident. For 4.4% of persons in the community at any one time is thought to have depression. 10 to 20% of primary care attendees is thought to have depression, and 10% of women who have given birth will have postpartum depression. It's a major cause of disability. As a matter of fact, it is in number one cause of this. It's the number one cause of disability in the world currently, and it is associated with high suicide rates. And it has severe impacts on families. It affects infant growth, family relationships, child rearing, and most persons with a significant non-communicable disease or a communicable disease that has huge social significance, such as HIV and tuberculosis, will develop depression at some point in their illness. And it's associated with high unemployment and worsening living conditions. And all the other factors that I spoke about earlier. So the core symptoms of depression. Persons cannot be said to be depressed unless they have persistently depressed mood or marked diminished interest in or pleasure from previously pleasurable activities for at least 2 weeks. There are other symptoms associated with depression, such as disturbed sleep or sleeping too much, significant change in appetite or weight, beliefs of worthlessness or excessive guilt, fatigue or loss of energy, reduced concentration, indecisiveness, observable agitation or physical restlessness, talking or moving more slowly than usual, hopelessness, and suicidal thoughts or acts. But these are the minor symptoms of depression. And you must have these two core symptoms: persistently depressed mood, meaning you have a depressed mood all the time, or markedly diminished interest in things that you used to like to do previously, and it must be occurring for at least 2 weeks. So depression can progress to self-harm, suicide. And so these are some of the facts about suicide. As I said earlier, chronic pain can result from road traffic accidents, and chronic pain is a known risk factor for suicide. Suicide is the second leading cause of death among 15 to 29-year-olds. Close to 800,000 persons die by suicide every year. There is one death every 40 seconds. 78% of suicides occur in low and middle income countries. Pesticides, hanging, and firearms are the most common methods used globally. And in Guyana, the most common method is pesticides. And there are more deaths from suicide than from war and homicide together. The other issue that can result is substance misuse. I think that nearly everyone has consumed alcohol at some point in their lives, but are we a problem or a public health risk? So it is estimated that 5 to 35% of all road deaths are alcohol related. Driving under the influence of alcohol significantly increases the risk and severity of a crash. What is considered under the influence? Now, if your blood alcohol concentration is 0.04 grams per deciliter or more, that person is considered to be under the influence of alcohol. Not everyone who uses substances will have a problem, but some will. There are two types of behaviors that will denote someone who has a problem with their substance use. That is harmful use and dependence. What is harmful use? Harmful use is a pattern of substance use which is causing harm to health. For example, the harm may be physical, like liver disease, or mental, for example, episodes of depressive disorder. And harmful use is often associated with social consequences, for example, family dysfunction or work problems. What is dependence? Dependence is a cluster of physiological, behavioral, and cognitive phenomena in which the use of substances take on a much higher priority for a given individual than other behaviors that once had greater value, and it's characterized by strong craving to use the substance, loss of control over consumption of the substance, high levels of substance use, and the presence of withdrawal state upon cessation. So that last one is a very important distinguishing factor for dependence, when there's a presence of withdrawal upon cessation of the alcohol or other substance. And alcohol use has high impacts. Harmful use of alcohol results in 3.3 million deaths each year, or 5.9% of all global deaths. In 2012, 139 million DALYs, which is disability adjusted life years, or 5.1% of the global burden of disease and injury, were attributable to alcohol consumption. Alcohol-related harm is determined by the volume of alcohols consumed, the pattern of drinking, and on rare occasions, the quality of alcohol consumed. An estimated 250 million people, 1 out of 20 people between 16 to 64 years, used illicit drugs in 2014. And 1 in 10 of those people are suffering from a form of drug use disorder, including drug dependence. Almost half of people with drug dependence inject drugs, and more than 10% are living with HIV, and the majority are infected with hepatitis C. And stigma and discrimination have prevented these people from receiving the care they need. So those are some of the major mental health issues that are associated with road traffic injuries and persons with disabilities, persons suffering from disabilities that result from the road traffic accidents. So, future perspectives. So, I guess a lot of persons have heard about the Sustainable Development Goals of the United Nations, and these are 17 interlinked global goals set by the United Nations in 2015 by the United Nations General Assembly. And these goals are intended to achieve a better and sustainable life for everyone on the globe by 2030. And those goals, which are applicable to our discussion about road traffic accidents today, are the following. SDG target 3.6, which states that by 2030, half the number of deaths and road traffic and injuries from road traffic accidents. And SDG target 11.2, which states by 2030, provide access to safe, affordable, and accessible and sustainable transport systems for all, improving safety and notably by expanding public transport with special attention to the needs of those in vulnerable situations, such as women, children, persons with disabilities, and older persons. First of all, to achieve those goals, financing must be available. Financing is important for anything that you're going to do. So it is therefore the responsibility of the government to ensure that the funds are sourced, whether from taxes or social insurance or whatever, and collected in order to purchase and provide the necessary assets and services. Services purchased and provided should have the net effect of being quality, being efficient, cost-effective, and affordable and accessible to everyone, with safeguards to ensure that the poor are not exploited nor plunged into further poverty. Here in this slide, we see some of what is extremely necessary for reducing road traffic accidents. And there we see a cyclist in a cycling lane, safe pedestrian crossings, and what looks like very nice, safe walkways. As I was doing my research for this presentation, I discovered that the United Nations had 85 regulations for manufacturing and maintaining the safety of motor vehicles, which if it was adhered to, is expected to cause significant reduction in road traffic accidents. Earlier in the presentation, we saw that Europe had the lowest rate of road traffic deaths, sorry, per 100,000 population of all the WHO regions. And it is thought to be due to adherence to these regulations. It is necessary to invest in post-crash care. There are a significant number of persons who die before reaching hospitals in low and middle income countries, in contrast to high income countries. And these investments should include national toll-free numbers, enough equipped ambulances with certified and capable care providers, specialist trauma care providers and facilities, and of course, the capacity building should be continuous. So there should be programs for training of trauma specialists. Since disabilities and mental health care often accompany road traffic accidents, disabilities and mental health issues often accompany road traffic accidents, it is equally important to invest in mental health care and care for disabilities. So you would want to make sure that there is specialist teams available to treat all these conditions that we had mentioned earlier. Depression, stress, post-traumatic stress, self-harm, suicide, alcohol, substance misuse, epilepsy, and the actual physical disabilities, etc. Now, in the case of alcohol and substance misuse, there have been lots of recommended interventions that will work well in reducing the incidence of alcohol and substance misuse. And these are some of the interventions that have been recommended by the World Health Organization. Increase excise taxes on alcoholic beverages. Enact and enforce bans or comprehensive restrictions on alcohol advertising. Enact and enforce restriction on the physical availability of alcohol through reduced hours of sale. Enact and enforce drunk driving laws, blood alcohol concentration limits via sobriety checkpoints. Provide brief psychological interventions for persons with hazardous and harmful alcohol use. Carry out regular reviews of prices in relation to level of inflation and income. Establish minimum prices for alcohol where available. Enact and enforce an appropriate minimum age for the purpose of consumption for the purchase and consumption of alcoholic beverages and reduce density of retail outlets. Restrict and ban promotions of alcoholic beverages in connection with sponsorship and activities targeting young people. Provide prevention, treatment, and care for alcohol use disorders and morbid conditions in health and social services. Provide consumer information about and label alcoholic beverages to indicate the harm related to alcohol. Other future perspectives will include research so that interventions are data-driven. We need to use sensitive indicators with metrics such as reduction in hospital bed days to road traffic victims. We need to use comprehensive information systems which can yield information on the go. Also, to scale up acquisition of the latest technologies which can assist in road safety and medical care. Scale up of advocacy and awareness and the use of campaigns. We need legislation to enforce speed limits, blood alcohol levels, use of protective gear such as seatbelts, helmets, child restraints, and the manufacturing and importation of safe vehicles, etc. And there is need for multi-sectorial collaboration with all the relevant agencies such as health, infrastructure, legal, police, city planning, non-governmental organizations, international agencies like the World Health Organization, the United Nations, and the World Bank, etc., so that there's a coordinated and effective effort in the target, which is reducing road traffic accidents and deaths, and the subsequent complications and sequelae. And finally, I would like to bring your attention to the driverless car, which is expected to be on the market by 2030, after which accidents are anticipated to be rare and air pollution from fuel emissions considerably reduced. Using high-resolution cameras and other software, this car will be able to track objects around it, identify where pedestrians, cyclists, and other vehicles and objects are, and the direction they are going, navigate them, brake when necessary, keep you in your lane, and they are also expected to be able to drop you off, park miles away, pick you up at the required time. And all this, as I said earlier, is expected to become a reality by year 2030. So let's look forward to the future where road traffic accidents is no longer a public health issue. That brings me to the end of my presentation. Thank you for listening. Thank you again.